Good evening, dear friends and colleagues. Today I'm going to talk about exercise and the brain. To be more specific, I'm going to talk about how exercise can improve academic performance for your child. Now, when I grew up in China, I can still remember the last year of my middle school and high school. Why? Because something similar would usually happen. The PE classes would always be taken away. Usually the teacher in charge of a class would come into the classroom and tell us, oh, the PE teacher is sick today, the PE teacher is on a leave today, or whatever. There's always an excuse, and the teacher would tell us, oh, take out your books and your test from yesterday and let's review the test. Usually the teacher in charge of a class would be a math teacher or Chinese teacher or an English teacher. Well, after all, these are the most important three subjects for an entrance exam to a higher educational institution. So that's my story and my experience in China. I'm not sure if it's similar in Canada. But actually, when I saw the topic of the interpretation practice of this month, I wanted to make a speech on this topic because I wanted to explore the relationship between exercise and academic performance. And I did my research online. It turns out that even 30 minutes of jogging can help a student solve problems up to 10% more efficiently. So taking away our PE lessons or PE classes did not do us any good. In fact, the more physically active that children and adolescents are, the better they can perform academically. If you are a parent, do you want your child's literacy scores to double? Try and start the morning with some cardiovascular exercise with your child. Do you want to see an improvement on coordination and memorization tasks? Try some resistance training. According to a research from the University of North Texas, maintaining a healthy body may be one of the most important factors in determining a student's success in math and reading. There are lots of researches supporting this idea that students need more physical activity. Of course, exercise helps prevent obesity-related illness. Also, it increases academic performance. Now, as stated by the Centers for Disease Control and Prevention, physical activity can have an impact on cognitive skills and attitudes and academic behavior. All of these things are important components of improved academic performance. These include enhanced concentration and attention, as well as improved classroom behavior. Now, I wonder why. Why does exercise impact academics? Is it about our brain? Is it about blood flow or oxygen level? What is it? I think there are many reasons we can talk about. But I'm going to begin with the impact on the development of the brain. A researcher, Charles Bask, from Columbia University, he outlined how exercise affects executive functioning on the brain. There are three main points from his research, and I'm going to give you the gist of this research. Now, first, exercise helps to increase brain-derived neurotrophins that support neuronal differentiation and survival in the developing brain. Neurotrophins. What are neurotrophins? They help the survival of neurons in areas responsible for learning, memory, and higher thinking. Second, exercising helps to increase flow of oxygen to the brain. So I will write down. With more oxygen, of course, we can think faster. Third, exercising helps to increase brain neurotransmitters. Also, think faster. Now, in brain scans immediately following 20 minutes of sitting sedentary versus 20 minutes of walking, the amount of neural activity is apparent. In children who spend the time sitting, minimal activity is observed. In other words, little brain activity is evident. So your brain is not working. In children who spend the time moving, however, substantial brain activity takes place. Again, the brain is working. What's more, the benefits increase over time so that children who exercise consistently during a 9-month period would see more benefits than a child, say, who exercises a lot or frequently in 1 month. So these are the results from this research. Now we've talked about the factors, the impacts, the benefits. But how? How can we get our children to have more exercise? A lot of parents are worried about their children not getting enough exercise. And actually, according to this research, the most common approaches tackle 3 main areas. First, school life. Second, home life. And third, professional intervention. Now, what about some general recommendations? The CDC recommends that children and adolescents participate in at least 60 minutes of physical activity every day. For the most benefits, the majority of exercise should be aerobic. Now, also, there should be some time spent on doing muscle strengthening exercise and some time spent on doing some bone strengthening activities. So first, school life. With an increased focus on standardized testing and Common Core standards, there has been an unfortunate decline in physical fitness offerings at school. Now, this is detrimental to children's physical and mental health. Also, of course, academic achievement. One way to improve this is to increase the time spent in PE classes. Also, before and after school, activities should also be offered. What's more, I think it's time to get creative. Teachers of academic courses can incorporate physical coordination into their lesson plans. Second, home life. Families can model healthy behaviors by participating in sports together, going out for a walk, partaking in physical activities, and generally spending more time away from the couch. Children's first teacher is, of course, at home, and this is often where healthy choices are either encouraged or discouraged. Third, professional intervention. Many families struggle to know the best exercise plan for their child. So a lot of parents would turn to professionals. For instance, pediatric physical and occupational therapists. And they can sit down with the professionals, their children, and they can develop a plan together. These therapists can help people become active while reducing unnecessary pain. They can guide students through physical movements and teach safety measures which are important to success. Often, these professionals will measure a child's current fitness level first and then develop a plan which is appropriate to the child's needs. Now, if you are seeking professional insight and if you want some help encouraging your child to become more physically active, I think it's not a bad idea to consult with a pediatric therapist for guidance. And actually, recently I've heard some good news from China. The government is having a clampdown on cramming schools, so hopefully those PE classes will stay there in the last year of middle schools and high schools in China. Thank you.